you have a really sharp pain in your bottom when you poo, then you could have something called an anal fissure, which is where there is a tear in the anal lining. In today's video, I'm going to share with you my 10 top tips to help relieve the symptoms of an anal fissure. So let's get started. So tip number 1 is to increase fibre intake. Eating a high fibre diet can help to prevent constipation and ensure smooth bowel movements. Food like beans, nuts, lentils, broccoli, avocados and chia seeds are all foods that are naturally high in fibre. Now each day you should aim for between 25 and 30 grams of fibre to keep your poo soft and reduce strain during bowel movements. This is going to really help if you have an anal fissure, as well as help to prevent one from forming in the first place. Tip 2 is to stay well hydrated. Drinking plenty of water is crucial for maintaining soft poos that are not too hard and likely to cause pain when you're going to the toilet. Now, general advice is to drink at least 8 glasses of water a day, but this will obviously vary from person to person. But I find that it's a good rule of thumb. You also want to avoid getting to the point where you're feeling thirsty, because at that point you're probably dehydrated. So try to have a water bottle with you throughout the day and just take regular drinks. Proper hydration essentially supports your digestive system and helps to prevent further irritation to the fissure. Now tip 3 is to use a stool softener. Now if you're having difficulty going for a poo despite increasing your fibre intake as well as your water intake, you could consider using an over-the-counter stool softener that you can buy from your pharmacist. Now this can make bowel movements less painful as well as reduce the risk of further tearing. Now please don't be embarrassed speaking to your pharmacist about this. They'll be more than happy to help you and advise you on which one you could try. And if you do decide to try this option, remember to follow the instructions on the packet or speak to your pharmacist if you're unsure about anything. Now tip 4 is to try and soak in a warm bath. Now this can help soothe pain as well as promote healing. So fill a bathtub or a large basin with warm water and sit in it for about 10 to 15 minutes, especially after bowel movements. Now this generally just helps to relax the anal muscles and increase blood flow to the area. Tip 5 is to speak to your pharmacist about creams or gels that could help provide relief from pain and inflammation. Now you should look for over-the-counter creams or ointments containing ingredients like lidocaine, which is a local anaesthetic for pain relief, or hydrocortisone, which is a mild steroid for reducing inflammation. Prescription treatments such as nitroglycerin ointment can help to relax the anal sphincter as well as improve blood flow, but always speak to your pharmacist or doctor before starting any new treatments if you've got any doubts or uncertainties, as well as to make sure that they're suitable for you. Tip 6 is to try and maintain good hygiene. Keeping the anal area clean and dry is essential for healing. Gently clean the area with warm water after your bowel movements and pat it dry with a soft cloth. Avoid using harsh soaps or wipes that can irritate the skin. Now tip 7 is to avoid straining when you go for a poo, and that's because straining can worsen an anal fissure. Take your time during bowel movements and avoid pushing too hard. And if necessary, some people find that using a footstool to elevate your feet when sitting on the toilet can help you pass stools more easily, and that's because it straightens the anal canal. Now some people suggest that applying a small amount of KY jelly or lubricating gel can reduce friction and make it easier to pass stools. And this can help minimize pain as well as prevent further tearing. Now tip number 9 is to eat smaller, more frequent meals, which can help regulate your digestive system and prevent constipation. You'll find that the key thing that we're talking about throughout these tips is to try and prevent constipation in the first place. So avoid large and heavy meals that can put extra strain on your digestive tract. Finally, this can be easier said than done, but stress can impact your digestive health and exacerbate symptoms, and that's why I would suggest that if you have an anal fissure, try practice stress-reducing techniques, so things like deep breathing exercises, meditation, or yoga. Regular physical activity can also help reduce stress and improve overall well-being, and obviously all of these things are going to have positive knock-on effects for your general mental and physical health overall. Now if you've got any tips that you'd like to share to help others, please do leave them in the comments section of the video and check out the description box for lots more useful resources.